If you're looking into case management, one thing becomes clear pretty quickly. There isn't just one version of this role. And one of the biggest differences you'll come across is hospital versus remote case management. At first, it might seem like a simple choice. One is in the hospital, one is at home. But in reality, the difference goes much deeper than that. Because these two roles don't just look different, they actually require different ways of thinking and working. Let's start with hospital case management. This is the environment most nurses transition into first. You're inside the hospital, working directly with the care team. Doctors, nurses, social workers, you're all communicating throughout the day. Everything is happening in real time. Patients are actively being treated, and you're constantly evaluating what needs to happen next. You're asking questions like, what's the plan for discharge? What needs to be arranged before the patient can leave? What could delay this process if we don't address it now? Let's walk through a real scenario. A patient is approaching discharge. Medically, they're improving. The provider is preparing to clear them. Now your role starts to become more active. You're checking for rehab placement or home health availability. You're coordinating with the physician to confirm readiness. You're communicating with the patient and their family about next steps. And throughout the day, things change. A facility might not have an open bed. Insurance might need approval. The patient's condition might shift slightly. So you adjust. You follow up. You pivot. You keep the process moving. Because you're physically there, you have access. You can walk down the hall and talk to someone directly. You can clarify things quickly. You can get answers in real time. That proximity makes a difference. Now let's shift to remote case management. This is where things start to feel very different. You're no longer in the hospital. You're working from home or from an office. You're reviewing charts, making phone calls, coordinating care from a distance. At first, that might sound easier. No running around, no constant interruptions. But the challenge is, you're not seeing things directly anymore. You have to build the entire picture yourself. Let's walk through a remote scenario. You're assigned a patient who was recently discharged. You open the chart and start reviewing their case. Everything looks fine at first, but then you start noticing gaps. They missed their follow-up appointment. They didn't pick up their medications. There are notes about confusion during discharge. Now you start asking questions. What actually happened after they left? Why didn't the plan work? What needs to be fixed now? So you reach out. You call the patient. Maybe they tell you they couldn't get transportation. Maybe they didn't understand the instructions. Maybe they thought they were fine and didn't need follow-up. Now you're stepping in to stabilize the situation. But here's the difference. You're doing all of this without being physically present. You're relying on communication, on documentation, on your ability to interpret what's actually going on behind the scenes. And that requires a different skill set. In the hospital, you're reacting in real time. In remote roles, you're often identifying problems after they've already started, and then working to correct them. Another key difference is workflow. Hospital case management can feel unpredictable. You might start your day with a plan, and by midday, everything has changed. New patients, new complications, new priorities. You're constantly adjusting. Remote case management tends to be more structured. You may have a set number of cases assigned to you. You may follow a defined process for reviewing and following up. There's often a clearer workflow. And for a lot of nurses, that structure is appealing. But it also requires independence. You don't have immediate access to a team in the same way. You can't just walk over and ask a quick question. You have to rely on your own judgment more often. You have to be comfortable making decisions with limited information. And that's where some nurses struggle. Not because the role is harder, but because it's different. Now let's talk about pace. Hospital roles are more immediate. Things happen quickly, and you respond quickly. Remote roles are more controlled. You still have responsibilities and timelines, but the pace is less physically intense. That can feel like a huge relief for some nurses, but for others, it can feel like a loss of energy or connection. So, which one is better? That's the question a lot of nurses ask. And the answer is, it depends on you. If you like being in the middle of the action, if you enjoy quick communication and real-time problem solving, hospital case management might be a better fit. If you prefer a more structured environment, if you like working independently and thinking through problems, remote case management might make more sense. Neither role is easier. They just require different strengths. Hospital roles are more immediate and collaborative. Remote roles are more interpretive and independent. And understanding that difference is important, because choosing the wrong environment can make a good role feel frustrating, but choosing the right one can make the transition feel natural. And that's the goal, not just leaving the bedside, but moving into something that actually fits how you think, how you work, and how you want your day-to-day life to feel. And if case management is the path you're curious about, we have a place for you to start. To better understand case management beyond the bedside, click the link below and visit the CMI landing page. You can start learning what case management is, how the role works, and how your nursing experience can translate into this next chapter of your career. Because your nursing career does not have to end at the bedside. It can grow from there. And if you're still comparing your options, watch one of the videos on screen now.